Palonosetron solution is a medication used to prevent nausea and vomiting caused by cancer drug treatment and after surgery. It works by blocking a natural substance in the body that causes vomiting. It is important to take this medication as prescribed by your doctor. The recommended daily dosage and the optimal timing for taking this medication will depend on your individual medical condition and response to treatment. Be sure to follow your doctor's instructions carefully. Before using Palonosetron, make sure to read the patient information leaflet provided by your pharmacist. This medication is administered by injection into a vein by a healthcare professional, typically 30 minutes before chemotherapy or right before surgery. The dosage will depend on your medical condition and how you respond to the treatment. For children, the dosage will also be based on their weight. If you experience vomiting or nausea, be sure to inform your doctor. If you experience pain, redness, or swelling at the injection site, or if you have a headache, constipation, or diarrhea, be sure to let your doctor or pharmacist know. This medication may rarely cause a serious condition called serotonin syndrome/toxicity, so it's important to seek medical help right away if you develop symptoms such as fast heartbeat, hallucinations, severe dizziness, or severe nausea/vomiting/diarrhea. Be aware that a serious allergic reaction to this drug is rare, but if you notice any symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. Remember, this is not a complete list of possible side effects, so if you notice anything unusual, contact your doctor or pharmacist. And always be sure to inform your doctor or pharmacist about all the medications you are taking. Before starting Palonosetron, make sure to inform your doctor or pharmacist about any allergies you may have, especially to other anti-nausea serotonin blockers. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Be sure to also inform your doctor or pharmacist of your medical history before starting this medication. If you are planning to have surgery, it's important to disclose all the products you are using, including prescription drugs, non-prescription drugs, and herbal products, to your doctor or dentist. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if the medication passes into breast milk. When taking Palonosetron solution, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, if you are taking other drugs that increase serotonin, such as certain antidepressants or street drugs like MDMA, there is an increased risk of serotonin syndrome/toxicity. This risk may be more likely when you start or increase the dose of these drugs. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. If someone has taken too much Palonosetron solution and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center for assistance. Palonosetron solution is used to prevent nausea and vomiting caused by cancer chemotherapy. It works by blocking the action of serotonin, a natural substance in the body that can cause nausea and vomiting. This medication is given by injection into a vein as directed by your doctor, usually 30 minutes before the start of chemotherapy. The dosage is based on your medical condition and response to treatment. Take this medication by mouth as directed by your doctor, usually within 30 minutes before the start of chemotherapy. Make sure to take each dose of Palonosetron solution as directed by your doctor. If you happen to miss a dose, it's important to consult your doctor or pharmacist for a new dosing schedule. It's crucial not to take a double dose to make up for a missed one. As for the optimal timing, it's best to follow your doctor's instructions on when to take this medication. This medication, Palonosetron solution, is not applicable for home use as it is only administered in a clinic setting. It is not meant to be stored at home. It is used to prevent nausea and vomiting caused by chemotherapy or radiation treatment. The dosage and timing of administration will be determined by a healthcare professional based on individual needs. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.